Hey guys, my name is Johanan. I was a camper at Blue Ridge for 1 year when I was in high school. And I was a counselor for 3 years when I was in college. I might say my favorite memory isn't really one specific memory, but it was a certain amount of times every summer when I would be playing frisbee with my friends just outside. Um, After having done a hard run, the fun part was getting to play frisbee with those friends that I made at Blue Ridge, many of whom I'm still friends with actually, outside of the camp. So there are some lasting relationships there that came from coming to Blue Ridge running camp for years. And I'm currently here in beautiful Portland, Oregon, at the Nike World Headquarters. I'm at the track on the Nike campus, and you might know it. It's the iconic track in the middle of the forest. And there are a lot of pros that train out here. And I'm not here because I'm a running professional, not because I'm a professional runner, but it shows how I still keep running as a lifestyle. And I see how it's rewarding and it's fun. And I attach so much of what's rewarding and what's fun to the fact that I was a counselor at Blue Ridge for a few summers, and because I was a camper as well. And yeah, so I know that you guys can have the camp right now because it's gone virtual this year, but I hope you guys all make the most out of this week at camp. So yeah, take care everybody.
Hey, Blue Ridge Running Camp. My name is Beth, and I'm here to share with you a couple of things that I remember about my time at Blue Ridge Running Camp. So I was a camper for 5 years. I started going to Blue Ridge Running Camp when I was in 8th grade. Coach Dave Davis was my coach, and he is an amazing person, amazing coach. I went for 5 years, all the way through my high school years, and then I actually came back for another 5 years as a college counselor. So I couldn't get enough of it. Every single year was pretty amazing. I learned something new every year, even when I was in college. I got to meet lots of new people. Some people I'm still friends with to this day who I met at camp. And I just enjoyed spending some time in a college dorm, especially when I was in high school. It was a very cool experience. I think my favorite memory of Blue Ridge Running Camp every year would be waking up that first morning in the dorm room and thinking to myself, okay, who am I going to know in my group? I thought it was so fun to be walking down to the track and you just see hundreds of runners and walking down together, and everybody's looking for their group. And just thinking to yourself, okay, am I going to have a teammate in my group with me, or am I going to be by myself? Like, will I have to meet new people? Most of the time I was either had one teammate with me or by myself, but every time it was just, I met so many people. So it was really cool to kind of put myself out of my comfort zone and open up and talk to new friends. And then I got to see them at different races throughout the year, which I thought was pretty cool. Always being able to say hi and kind of catch up when we saw them in indoor track or on the cross country course. It was really fun. So I can't say enough good things about Blue Ridge Running Camp. I have just taken so much from it, and I just love it. So to all the people who've supported me throughout the years there, thank you guys, and I'm hoping that it's back again next year, and that those of you who are doing the virtual camp this year get something out of it, because it is awesome. So thanks for watching, and I'll see you later. Bye.
Day 3 of camp, and I'm gonna try something new. It's daily introductions, and it's gonna rhyme too. Typically on Wednesday we all wake up sore, 'cause Tuesday Reddish Knob is a view worth running up for. I know at home you're all missing that 6 a.m. run. Without running groups, things aren't quite as fun. We all miss Blue Ridge. Camp is absolutely the best. Without two-a-days though, we're getting more rest. Enjoy tonight's session, 2 more till they're done. Can't wait to see ya.
Good evening, Blue Ridge Running Camp. I'm Matt Walton, and I'm part of camp staff here. Tonight, we are going to hear from Dr. Doug Cutter and physical therapist Steve Butler. They are going to answer a lot of questions that we've received about how to prevent injuries. They're also going to talk about different parts of the anatomy so that you can properly describe how what you're feeling and when you're hurt to your athletic trainer, to your coach, to sports medical staff. And we're going to see some drills from Steve Butler to help you with your running form and also stretching and some injury prevention. So please enjoy these speakers this evening. We miss you at running camp, and we look forward to seeing you again. And we will wrap up after their presentation with a few more words. But here are Steve and Doug.
Hi, I'm Dr. Doug Cutter. I'm the medical director here at HCA Virginia Sports Medicine, and Steve Butler and I have been to the running camp up there at Eastern Mennonite University for many years. And this year, unfortunately, we are doing this virtual, and we received quite a few questions from campers, and we're going to address those questions. We're going to make this conversational. Afterwards, I think we're going to also do a second part where there'll be demonstrations on this, and we hope we can make this informative and worthwhile for everybody.
Sounds good. I'm a physical therapist. I've been here for a good number of years, not quite as long as Dr. Cutter, but enjoy working with runners and have enjoyed going to the Blue Ridge camp every year. You guys have a special group of coaches, and so hopefully we'll be able to contribute in a good way for you all to help prevent injury and then maximize your performance.
Steve underestimates his contribution to running, okay? He's one of the best running therapists in probably the state.
Thank you.
So our first question, muscle soreness, how to relieve it and be able to practice with it. So, I think there's a couple different ways to approach that. I think, first of all, when it comes to your level of activity, don't go into a practice with soreness. I mean, I think that's important. So, which means kind of like doing a, periodization of your training. But if you got muscle soreness, I mean, there's a whole bunch of things that we do in PT. And Steve, why don't you talk about that for right now too?
Yeah, if you have an acute onset of muscle soreness, say after a track workout or hill repeats, I would say the next practice, if you feel up to it, decrease your intensity significantly. So run maybe a long, slow distance. You could talk to the coach about the muscle soreness, because if you go at it hard with muscle soreness, you're going to chance injury. This is a great tool you probably know very well that helps work out muscle soreness, the massage stick and the foam roller. But if it goes beyond just a couple of days, then it could be more than just delayed onset muscle soreness. It could actually be an injury that could require seeing Dr. Cutter or coming to physical therapy.
And sometimes that muscle soreness, especially that delayed onset of muscle soreness Steve was talking about, is from what we call eccentrically loading your muscles. So, for instance, that's like running downhill, getting quad soreness. All right, that type of eccentric injury can really cause significant problems and get in the way of further running. So another kind of way, not just the massage, the stick, the foam roller. I think it's very important after a heavy workout, especially if you do produce some muscle soreness, to consider cold water immersion in those muscle groups. So I think that helps pretty much too.
Yeah, that's one of the questions coming. Oh, that's the next question. Actually, ice baths.
Oh yeah. Okay. Good. So let's just go right. Let's go right to that. Perfect. Going into that, I've seen great response if after some running period of time, it may be a heavy workout, doing a cold water immersion. All that means is water that's cool as 55 degrees. That'll feel like ice water, and being in that for 10 minutes. Any type of these hot or cold is a 10-minute time frame. And I've even heard stories from certain coaches who have followed through on this for their teams and have had, a greatly reduced amount of shin splints, soreness in their knees, even sometimes ITB. So that means almost standing in water, like almost halfway up your thigh. So I think that works pretty good.
And take note of what Dr. Cutter said with the 55 degrees, 60 degree. It does not need to be a slush bucket. It doesn't need to be torture. 55 to 60 degrees is plenty therapeutic, and it's anecdotal, but I personally have experienced cold water after a hard workout, and it really does seem to help recovery. I don't know if the science bears it out, but I think there's enough anecdotal evidence that it can be beneficial after a particularly hard workout.
Well, it's interesting that when you see professional athletes, especially like professional football players in the beginning of their workouts in the season, they almost go into a total ice bath, okay? And how beneficial it is for some of their recovery. Yeah.
Yeah, Richmond even has, I think, it's a lounge chair that is
Yep.
cold compression for the whole body after hard workouts. So.
And actually, they now have these cold compression leg sleeves, okay, whole length. And actually, a lot of the professional baseball teams use those all the time.
Okay.
So,
Can be beneficial.
all right. So number number two, but it's really number three. How do you know when pain is serious enough to go to a doctor?
Good question.
Okay, that's a good question. And to me, it means it's if you found a change in your function. In other words, if you have a pain and you can't do the same thing normally, you can't run the same way, it changes your gait, you get into whatever running pattern, and it just makes it worse. That's a reason to go see a doctor. Okay, especially if this goes into 1 or 2, definitely 3 days. That's the pain you shouldn't be running on. You need to probably be evaluated.
There's some soreness that might show up at the beginning of a run and then it goes away.
Yep.
And you feel okay and maybe a little sore after, but you're good, and then the next day you're fine. Yeah, you don't worry about that. But it's that ever increasing ramping up pain. You definitely need to stop. You don't push through that, you don't run through that.
Yeah. And if it makes you limp or
Right.
have to
Alters
compensate for it, that's not good.
Right.
Okay, next one is, what are the best strength exercise to do to prevent injuries? Well, it all depends on what body part.
Right. Of course, lower body strengthening, the one we target the most and we see is often a problem with runners are the gluteals, especially the outer gluteals. And in part 2 of this, I'll be demonstrating some of the key exercises to target those muscles. That's probably the best way to say it. But gluteal and oblique strengthening, I would say if you had to really target one area, that would be it for that core control. But everything in the lower extremity can help prevent injury. And I remember one study years ago, they said strength training even once a week, lower body strength training even once a week can help prevent injury in runners.
How about let's talk about that strength training a little bit more in depth, because somebody might think, oh, that means strength training. That means I need to do maximum strength. I need to do a heavy lift, 2 or 3 reps of a maximum weight versus higher rep, lower weight. And again, I think that's a concept that we need to make clear. Okay, so I think you're not really trying to max out a weight on this thing. Okay, you're trying to increase the endurance and strength, but that doesn't mean doing something that's going to cause a bulk weight buildup. So a lower weight, higher rep type exercise is something I think we're probably talking about here.
There's a concept of power development. That's your really high intensity 1 or 2 reps with a max effort. Then you have strength training, which is 3 to 4 sets of 8 to 10. And then there's this zone that's kind of a strength/endurance, and that's where I think runners have their sweet spot. It's like somewhere in that 10 to 15 rep range. So you're working with a weight where you're fatiguing at 10 to 15 reps, and then you do about 3 sets of those. I think that's kind of the sweet spot for strength training for runners.
And I think that's a good point. It's fatigue, but it's not exhaustion.
Right.
Okay?
Yeah.
And that exhaustion weight training workout is one that causes the power. And in the runner, that's not where we're going.
Right.
So
There are some people during off season might work with some power development, power moves on
Okay.
distance runners. I know USA Track and Field does some of that, but I think that's for some really high level, and you got to get some really good coaching to do it right. I heard there was one presentation, I don't know if you were at this one, at the UVA running course, where the USA Track and Field strength coach spent 30 minutes teaching us a move, and we only learned half the move in 30 minutes. That's how much detail he was going in. So that was the power clean move. But anyways,
okay, next one. If you have had a running injury, is it likely to be reoccurring? Good question. Really good question. And I think there's a couple different ways to look at that. So if it's an injury that may have caused some tissue damage, possibly, okay? But the other thing is if it's biomechanical, okay? So if you have a reoccurring biomechanical issue, then it could be reoccurring, okay? And that's where, again, like an analysis and breakdown like what you guys do is perfect for that.
yeah, for runners, we almost always videotape your running so we can figure out if there is a biomechanical cause behind it. Sometimes it's just overuse.
Right.
And you have to let your body recover, rest, and then build back up, and you're good to go. But a lot of times there is a biomechanical reason why you're overusing that tissue, whether it's the shin splints, the medial tibial stress, or IT band. So yes, a thorough analysis helps evaluate if it could potentially recur and get to the root cause of it.
Yeah, and it can be something even as simple or kind of strange as even your arm swing. You know, if your arm swing is making you twist a certain way, and that's going to cause one part of your body to be used a different way than the other, possibly, and you know, just a whole host of mechanical issues. It's just amazing, and that's where I'm just so amazed how you guys can break this down.
Yeah, it is true though. The number one predictor of running injury is having had an injury at
Yes.
some point. So,
Yep.
but I think it's because a lot of people don't probably get to the root cause of it. They just think
Right.
about recovering, icing,
The pain's gone.
the pain's gone, and
Yeah.
they get going again.
Yeah.
Unfortunately, a lot of times it just comes back.
Okay, and this is a good one because this I know you have a really passion for, and you do a great job. How often should I change or get new shoes?
That's a good question. I think the general rule is still good to go by. 300 to 500 miles is what most of the manufacturers say. But there are shoes that have less to them. I run in the Ultra, if you can see the Ultra running shoe. Very small midsole, and since there's less to it, there's less to break down. I feel like I can go a little bit longer. But one of the tests I use with my patients is I'll just put their shoes up on a horizontal surface, and if they're leaning one way or the other,
It's a breakdown.
it's already broken down. It's probably too late. So don't go to the point where the shoes are actually losing their integrity. And there really shouldn't be that much wear on the bottom of the shoe. Don't take it to the point where the sole is totally worn out, because then you have an imbalance in the shoe. So
What was interesting is before mine wore out, okay, I used to know when to change my shoes because I would get a certain type of knee pain. And then that's it. I changed my shoes and the pain would go away.
right.
So, you know, and different runners have different styles of running, okay? And so the wear pattern might be quicker in some people. And, you know, Steve's a relatively light runner. And yet I remember, I mean, he's a fast runner, not a long distance runner. And someone like that I've seen is still a very heavy runner, not Steve, but some people. And those people wear their shoes out even more. So it is a very individual thing. And I agree with Steve, just keep track of the wear pattern on those shoes.
Right.
You know, whether it's a breakdown of the last or whatever it might be.
I like the 300 to 500 miles. Generally a good guideline.
Okay, how to understand and identify injuries without overreacting. I wonder what overreacting.
I would in my experience with runners, I think if anything, runners generally don't react enough. They just want to keep running. So, yeah. So I'd say that's probably, and there may be some people who are a little too focused on little aches and pains. I think that's more rare. So I think if you go by the guideline that we talked about earlier, if you have a little soreness at the beginning of your run and it goes away, it feels better, and you don't have any lingering pain afterwards,
Right.
or if you're not limping, it's not changing your gait, then you probably don't have to worry about it. So you don't have to worry about every pain. I mean, running, it's a hard sport, and sometimes you hurt. And it doesn't mean you're injured.
Runners are very, very body tuned. They're very self-aware of their body. Okay, and I don't care if it's the high school runners or the more the elite runners or the adult runners. Is they'll come in with, I think this is just a soreness. I don't think it's a pain.
Mm-hmm.
But when you get to the pain, identifying as a pain, that's when, again, you probably need to get this thing evaluated.
Right. Is it good to have 2 pairs of shoes and alternate them? I think the research bears out that yes, you can. There is the material in the midsole. Now that has changed, so I haven't actually heard anything recently. But the traditional EVA midsole does have a recovery period of like 2 days. So you can switch your shoes out every other day and get longer life. You could probably more go to the 500 miles for sure if you're switching out shoes. Now these new foam midsoles, I don't know if I'd say you'd have to ask a guy at the running shoe store to see what the answer is on that, if they have the same.
They want you to have 3
recovery
pairs
period.
of shoes.
That's true. Yeah, they'll say you need to switch out 3. No, just kidding. But generally speaking, that has been shown to make the shoes last longer.
Yes. Okay, how do I deal with ITB injury, treat and stretch? Okay. Well, the key thing about ITB injury, first of all, it can be an overuse injury, but it can also be a mechanical injury. And all too many people just say, oh, it's just I've been running too much. But that's where getting an analysis, whether it be through the physician or through the physical therapist, is real important. Because sometimes it's not just that overuse. It's not too many miles. Many times it can be. But if you get, your gluteus medius doesn't work, or you have a crossover stride or something like that, or you're running on a canted road or something. So there are a lot of intrinsic and extrinsic factors for producing that ITB. But preventive-wise, I think you just keep stretching, you keep icing, you keep doing your foam rolling the right way too. Are you going to go over that ITB foam rolling?
Yes.
Yeah.
I was going to talk about that, and there's actually a trigger point that I find on every IT band, right above the knee. You'll find it right here, and if you've had IT band, you will know this spot. And I think it's just a reaction of the muscles. They get really tight. And when those muscles are tight, they put even more tension on the IT band. So then you're even more vulnerable to that friction because there's more tension in the system. So using the massage stick or the foam roll, I do some dry needling too. I found it to be very effective for getting rid of trigger points right there in that spot. I've done it on myself after runs before. But I think every IT band patient I've ever seen, it's not just one thing.
Yeah.
There's a combination of factors that caused it, and the camber of the road is a huge one. So I say avoid running always on one side. That can be, try the other side. Sometimes that takes the pain away in the short run. Increasing your cadence, your step rate, if you have a low step rate, increasing your step rate can help a lot actually. It brings your foot strike a little closer to your center of mass. So that decreases some stress on the IT band. So, and then we'll talk about when we do the exercises, some of the glute exercises that have been shown to be really effective for helping to prevent it.
Prevention of shin splints.
I'd say that being in the right shoe is probably one of the most important things. Historically, there was I found a lot of the mindset in the shoe industry was to stop pronation and correct, and I found a lot of runners were overcorrected. I don't think that's as big a problem, at least I'm not seeing it locally here. So if you're in a real heavy stability shoe and you have neutral mechanics, you don't have good shock absorption, so that can lead to shin splints or that tibial stress.
Probably also overstriding, right?
Yes.
Don't you think?
Overstriding
Yeah.
is a huge
factor.
Yep.
Huge
And in
factor.
fact, there's a famous, really good research study that has shown that in high school runners, actually. They studied cross-country runners, and if you're, they actually looked at stride rate, which is a factor of overstriding. So if your stride rate, how many times your foot hits the ground in a minute, was under 164, if I remember correctly, that's counting both legs, of course, you are much more prone to bone injuries, stress injuries, than someone whose stride rate is over 174. So if you have a faster stride rate,
Think about
shorter stride.
ground contact time too.
Yeah. So you're turning your legs over quicker, you hit the ground, you get right off. So there's less time in contact with the ground with that higher stride rate. And there's much less overstriding, which is landing way out in front of your center of gravity. And I believe there's a question down here on how to decrease heel striking. And I'll show some form drills later on that can help, which is good treatment for shin splints too.
But don't you think that can happen a lot in cross country because of the downhill run? You know, when they have to go downhill, they naturally do
definitely.
overstride too.
Yeah.
So that could be a big factor in the
Right.
in causing the shin splints, but it's part of the cross country.
Right.
You know,
And
activity.
how you attack a hill downhill.
Right.
You know, there's different viewpoints on that. Sometimes you just open up and go for it, but that's running the risk of putting a little more stress on your knee and a little more stress on your tibia.
Eccentrically, yeah.
So, all right. Any other?
How can you continue to run with shin splints?
You know what I wrote on that? Don't, or in water. Run in water.
Remember the key thing about a shin splint is it's on. You know, we talk about this thing. I'm gonna try to draw this little thing here, and maybe it'll show up on the thing or not. I'm not quite sure. So, but I do want to try to just get this across to people. There's shin splints, and then something that's we're going to call stress injuries, okay? Which used to be called fractures, now we call them reactions, okay? And so people, the medical term is medial tibial stress syndrome, and it's not like it's either this or that. What it really is, it's a continuum between shin splints and stress reactions. It goes this way. So if you have a shin splint, you know, you jump into that in the stress injury side when it hurts all the time, when it hurts at rest. And so if you run with a shin splint, you are then heading yourself towards trouble, okay? And that's what you don't want to do. That's, you know, so running with a shin splint is pushing you that way.
Right.
So the key thing is, if you're doing those shin splints, you better start treating them. The cold water immersion. Sometimes we put people in a calf sleeve. A study out of the University of Rochester some years ago used the long air casts, giving compression on the shin, and that was supposed to help the bone cells mature quicker and complete its life cycle quicker to heal the stress fracture. But the calf sleeves work pretty good too sometimes. So.
Could you speak to the potential effect of non-steroidal anti-inflammatory like
Yeah,
Advil?
that's a good point. You know, we use anti-inflammatories all the time. The Advil, the Aleve, all these things, and we have such great access to these things. And there is growing literature that this quick jump to an anti-inflammatory is actually prolonging the healing process. And it comes with tendon injuries and the bone injuries too. So, you know, I think judicious use of an anti-inflammatory is okay, but not jumping to it quickly and keeping on it, because I think it actually causes more harm than good long term. long term.
And it's those first few days that are the most important, right? When your body is
3 days or so.
reacting,
Yeah.
your body's inflammatory process is reacting. That's part of the,
Yep.
the healing process. And if you chemically halt that, you may be delaying the.
Right. Whereas if you use cold in those early first 3 days, that's not a problem. You're not chemically altering that process.
Right.
Okay.
Pain control, swelling control for the cold, but yeah.
Actually increasing blood flow, which is helping the healing process too.
Right.
So.
So but mechanical evaluation for shin splints is very, very valuable. If it's one of those that's not just short-lived,
Right.
because you can get them when you're increasing your mileage, you can get a little shin injury, and then it just
Yeah.
kind of subsides.
If it hurts, if it stops hurting an hour or two after the run, and then you're probably okay.
Right.
You're probably okay.
So best core exercises.
Are you going to go over that?
Yeah, so we'll go over. It's hard to demonstrate that in this room, so we'll just do that on part 2.
Defer that one.
Yeah.
Okay.
So preventing plantar fasciitis.
Boy.
How to overall prevent? Can I say one thing?
Yeah. Oh, yeah.
Early treatment. So prevention's a little tougher to speak to, but from my personal experience, if you can nip it in the bud right away, it doesn't last long. It doesn't ruin your season like a lot of plantar fascia patients end up, with a prolonged problem. So the very first sign of plantar fasciitis is often the pain when you first step down in the morning, right? So, and I'm wondering if that's almost when the initial trauma, or at least exaggeration of trauma, happens. You might have made it a little sore the day before, but then you step down with this very tight tissue, like your calf is tight, and then boom, there's a sharp pain. Next day, don't do that again. Don't step down without stretching your calf muscle. So put a towel around your foot and stretch. Step into some shoes or maybe some recovery sandals. Some Crocs. Crocs are great because they actually have a little arch built into them and it's soft. So you want to protect your foot first thing in the morning. So I think if you do that right away, it tends to subside within a week or 2.
Yeah, that natural history of plantar fasciitis. I see people who come in and they're 3 months into it. Well, I can almost say you've got 3 more months at least.
Right.
Okay. So the natural histories, and over time, and this is just through the literature, is about 9 months. But the longer it takes before you treat it, the longer it takes to get better. So to Steve's point, if you hit it early, you're going to get over it quickly too.
Yeah.
So, the icing, one of the, core things they do regarding plantar fasciitis is I try to explain to the patient that plantar fascia is the ligament of your arch. And every body part is going to be stabilized by a ligament complex and a muscle complex. So if you work on your intrinsic muscles of your foot, you're going to help take some stress off that plantar fascia, which is kind of like the ligament that's just taking a beating every time that foot hits the ground. So sandals, if you wear sandals, some people wearing sandals, you actually have to grip your toes in that sandal, which I think is strengthening those intrinsic muscles. Can be very helpful for prevention.
I know a lot of the coaches will do some barefoot running on turf fields as a recovery, doing some striders and that sort of thing. That's a great way to strengthen feet, as long as you don't overdo it, but you build up gradually. But yeah, I think that's a fantastic way to help prevent plantar fasciitis by keeping your foot muscles strong.
And then, stretch your calf muscles, that addition as well too.
So one of the biggest risk factors is tightness in your calf.
Yeah.
So if you're initiating track workouts and that sort of thing, and you didn't prepare for it very well, and then your calf is super tight, that's setting you up for plantar fascia injuries. So after workouts, stretching. I have a slant board in the weight room when we demonstrate. I'll show you a couple of pointers on proper calf stretching to protect your plantar fascia.
Well, and the next one is how do you continue to run with plantar fasciitis?
Okay.
That's a tough one. If you're getting severe pain, and it's severe pain in the morning, and I think to me the thing that kind of jumps it even worse is it's part of the history you take. If you hurt sitting for 20 minutes and then getting up and walking, you've gone too far. That's over the edge. Okay, that's, you can't, don't try running with that. Okay, that's going to be too much.
If it's an early one and not too severe, I've had some good results taping the arch. So the athletic trainer
Low
in
dye
school might
strapping,
help.
yeah.
Yep. So the low dye taping for the arch, or an over-the-counter orthotic. If you're at a point in the season where you just, you're a senior and you don't want to take time off, that taping and maybe a little arch support can kind of get you through. But it's generally better not to try to run through plantar fascia. I had one story many years ago, a woman who qualified for Boston Marathon, and she knew she would never qualify again. She had horrible plantar fasciitis, and didn't come in until 2 or 3 weeks before the race. And so she was insistent on doing it, so I taped her up, and she finished it, but she ended up rupturing her plantar fascia in the process. So anyways, take that for what it's worth.
Best hip strengthening and flexibility drills. Again, do you want to demonstrate those later? Or
Yeah,
what? Yeah.
I have have it set up already. We'll do a couple things for the hip on that.
And then, best drill or method to reduce heel striking. You've got that. You're going to cover that too.
Yeah.
Okay. Okay.
Yeah. I don't know. It's kind of echoey in the other room, which is why we're here. So I'll just mention increasing your cadence. Actually, is one of the best ways to, if you're really what we would call a bad heel striker, where you're way out in front, hitting the back of the heel. Just shortening that stride up, increase your cadence by about 10%. That can make a big difference. And then little details on form drills you already know, the A skip, the B skip, butt kickers. I'll just show you a couple little tricks that really can help put your body in the right position to help get you off your heel, or a little less on the heel then.
Okay. How do you deal with knee pain? Well, it all depends what the problem is in the knee. So I mean, you're talking, patella tendonitis, patellofemoral issues, ITB. I mean, that's a hard, generic topic to talk about. I think deal with it is this way. If it's causing you a problem, decreasing your time, you can't participate as much in practice, you need to see a healthcare professional. Okay, you need to be able to see somebody who can help you get over this quicker. Don't use something out of a book, something you saw online. I think you need to see a really skilled physical therapist, and the athletic trainers are great resources that can help too.
Right.
Okay, sometimes it's just a flexibility issue, icing of certain things. Sometimes that will be a place for an anti-inflammatory, but most running knee problems are overuse itis issues, and they can be taken care of pretty well.
I found a lot of runners, high school, especially while you're still growing, have a lot of tightness in there's 4 muscles in your thigh. And one of those muscles is actually a 2-joint muscle, right? The rectus femoris that crosses the knee and the hip. And when you do your standard, you see me? Standard quad stretch like this, you only get 3 out of 4. You're not getting the 4th one. So a lot of the runners with the anterior knee pain seem to have a very tight rectus. And this is now my go-to stretch I tell everybody to do. And that will get, I'll do it sideways here. So when you get your knee up, your foot up, so now my hip is going backwards and I'm bending here, and that gets the rectus femoris.
This is the stretch I teach people too. Then I have them bend their other knee and then lean back at the same time.
Yeah, I've got nothing left. This is how tight I am. But yeah, if you want to increase it, do what he said, but I can't go any further. Mine's pretty tight too.
All right, how do you deal with a hamstring strain? All depends on where it is.
Yeah, that's a big one.
Yeah.
Got the high hamstring, or hopefully it's usually in the younger kids, it's usually down low, right?
Mid-substance, yeah.
So that's a better place to get a hamstring strain. In the middle of the muscle, there's a lot more blood flow. It tends to heal up quicker. The one thing I wrote here in response to that is rehab it fully.
Yeah.
It seems like, and why hamstrings more than others, I don't know, but it seems like you feel like you can get back sooner, it doesn't hurt anymore, you feel like you can run, and then you hurt it again, and then you hurt it again. And it's because you didn't fully rehab it.
And this, what, my standard speech to that and talk to that is having people understand when it comes to that muscle injury, there are three things involved. So the flexibility, the strength, and the endurance. And so you might get the flexibility back. You might feel it's strong, but if you don't have that endurance and that muscle injury back, then you go out, the other leg is fully recovered. It knows it can go on for X number of minutes. The injured one is X minus something.
Right.
So that's when it's going to fatigue and that's when it's going to pull again.
Yeah.
So you have to have the endurance build up in that muscle injury before it's really fully rehabbed.
Right.
Otherwise, it could happen again.
So really progressive running, progressive intensity, working closely with the coach on getting that back to full participation.
Sometimes, especially if it's a mid-substance hamstring strain, using a thigh sleeve helps pretty much. But as Steve mentioned, the higher the injury, the worse it is, because that's the tendon injury, and it doesn't heal as well.
So what do I do for Achilles tendonitis? Very common injury, especially with the kids. It's usually down to you can get the Sever's disease down to the attachment.
Yeah,
Right? But
it's just like the hamstring. It all depends on where the injury is too.
Right.
So if it's down towards the calcaneus, towards the heel, if that's an insertional tendonitis, and that can be a little bit more difficult. I mean, you guys do things like even a little bit of heel lifts in there, lots of icing, making sure they're stretching appropriately. I try to tell people to get away from eccentrically loading on the stretch,
right.
but eccentrically loading on the rehab is different.
Yeah.
Okay, and so that's a hard thing to get across. So like if you're stretching your calf muscle, make sure your foot is flat on the ground, not hanging off the ledge. Now the therapist will help the rehab of the Achilles tendon by doing progressive eccentric loading of that area. That's a whole different thing. That's the rehab, not the stretching of that area.
One of the common mistakes for any tendon injury, and I see it a lot with the Achilles, is overstretching. So because it makes the calf feel kind of tight, and then you just go at it, and you go online, and you see people hanging off the edge of the step, and then you're just putting so much tension in it. An injured tendon does not like to be yanked on like that. So, but I'll show you a couple of tricks. There's a couple little details in calf stretching when we go in the weight room that helps. Just be more gentle on it and more targeted at the calf muscle.
Okay, now we're back to the question we addressed a little while ago. What's best to take? Ibuprofen, which is Advil. Your other thought should be naproxen, which is Aleve, and Tylenol has no anti-inflammatory properties. Tylenol is for pain and for fever, and so it's but it has no anti-inflammatory properties. So if you're going to choose an anti-inflammatory, over the counter, your two main ones are ibuprofen or Advil, and then naproxen or Aleve. Now, what's important is how much do you take? Okay, if the box on Aleve or Advil will say 1 pill. Well, 1 pill does nothing. Okay, and if you're an adult, a kid in high school, the dosage for Advil or ibuprofen is 600 milligrams 3 times a day, which is 3 pills, breakfast, lunch, and dinner. If you're taking Aleve, it's 2 pills breakfast, 2 pills dinner. Now that being said, we just talked a few minutes ago about not taking these medications. So it's not taking the medications during the early time of the injury to allow the inflammatory healing process to occur. Later on, when you want to kind of snuff it out or direct it, that dosage I just talked about was the proper dosage to take. But even especially in kids, I don't like kids being on any of these anti-inflammatories for more than 7 or 10 days in a row. You got to get off it after 7 or 10 days.
I've heard of runners taking these anti-inflammatories before workouts and before races. Can you speak to the?
Yeah, I used to do it all the time.
Lack of wisdom of that.
Yeah, lots of it. You know, I mean, it's just like, yeah, when I used to eat Planters candy bars before running in high school. But I mean, a lot of times the thought there is you're trying to tamp down the inflammatory process. I think you're better off, you know, doing a good warm up, doing your stretch, getting the body prepared to run, versus trying to, you know, treat it with an anti-inflammatory before you run. So.
All right, so how do you maintain endurance with lower leg injuries? Apparently this person doesn't like pools, or they don't have access to a pool.
Yeah, yeah.
Pool running is quite a tedious activity, so I don't know if that was the motive behind this. But,
Yeah.
I'll have people go on the elliptical, a lot of lower extremity, especially in the stress category, like the medial tibial stress, shin splints. Then there's no impact, so the elliptical you can usually tolerate that very well. Even an IT band often tolerates the elliptical quite well, and you can get some great cardio. Again, it's kind of boring, but at least your legs are moving, and it's pretty comparable to running. Cycling, of course, is great. I'll have some people doing jump rope, again, if it's not a stress injury, but there's less knee motion, so IT band patients often can tolerate jumping rope. And even some anterior knee patients is jumping, but you're not going down into that painful range, so sometimes they can get some cardio that way.
Yeah, and I sometimes develop a little bit of a bike ramp exercise. You know, they do a 5-minute warm up, then every minute after 5 minutes until the 10-minute, they just go a little quicker, a little quicker, a little quicker, a little quicker, and so you're doing a little bit of almost like a fartlek training with that. So, and that's a good way to do it if you've got a lower leg injury too.
Yep, swimming is good
Yep.
for low leg injuries if you can get access to a pool, in the deep well running.
Okay, active recovery. Great thing to do. Great thing to do. So.
I don't know what else to say besides do it, especially after hard workouts. Well, two, if you do a long run, you know, doing a dynamic cool down afterwards, but definitely after hard workouts, track workouts, and hill repeats.
Yes.
You know,
And
2
this is my editorial on this. This is where I don't understand, you know, in cross country. It's high school and college. You know, the kids will gut it out and really push it at the end, and they hit that finish line and they hit the ground. Okay? That's where active recovery is necessary, at the finish line of a 5K, 8K run. Okay? So apply that thought of active recovery. It's not dying at the end, and so it doesn't apply just to your practices. It applies very much to your race regimen too.
Yeah. Keep moving, and when you get your heart rate back down, you know, a little jog for half a mile or a mile would be very good for you. You'll feel so much better the next day or 2 days later.
Finish moving. You know, that's the key thing.
Yeah. So piriformis stretching, what is the purpose? The piriformis is one of the deep hip rotators in the glute. So it's right in the center here. It's closely associated with the sciatic nerve. So if it gets tight, it can irritate your sciatic nerve and cause buttock pain and even some pain down into the thigh area. So I don't usually see this very often. I don't know if I've ever seen a high school kid with this problem, but it's more common in older adults. But anyways, yeah, keeping that muscle loose. If it's starting to get tight and irritate the sciatic nerve, that piriformis stretching can be helpful.
Yeah, I see the piriformis more of a problem in track season because the turns.
Okay.
Okay, versus on the cross country, that's more up and down
variety.
everywhere. Yeah, but it is, you know, it's part and parcel of the stretching process for the hip.
Right.
You know, the extensors, the flexors, and the rotators. So.
There's a question about hip mobility on here, and so we'll go over good technique for piriformis stretching. But
Okay.
it's and you're not just stretching the piriformis. Actually, there's 6 muscles in there that you're stretching when you do the piriformis stretch. They all work together to stabilize the hip. So just like any muscle, you don't want it to get tight from overuse, and stretching can really help with that.
Okay, how to understand and identify injuries without overreacting.
Oh, that was already up there.
Yeah.
That was repeated. Okay, I think we answered that one.
Okay, all right. And then hip flexors, the importance of stretching. Ugh. Wow, man. Yes.
Right here. Can you see me? Okay. My hip flexor goes from here to here, right? Or right here to here. It is shortened. Okay? This is a very shortened position for the hip flexor. And running, watch the difference. The leg's here and wants to go back. Especially if you want power, you need to be able to get hip extension. So, and what are you probably doing right now watching this video is sitting. What do you do all day in school? You sit.
Sit, yeah.
What do you do when you're gaming? You're sitting. So one of my big things is I tell so many patients during the day is get some tummy time, like you do with babies. You gotta get on your stomach.
Oh yeah, do prone push-ups.
And press up.
Yeah.
You know, if you go watch TV, get on your stomach and open up. So you're opening up these hips and arching back a little bit because we're always like this.
Yeah, and to me, part of the concept and part of the thought process in this is, remember, you know, you want these muscles to produce power, okay? And so if it's tight, it's producing that much power versus power from a greater range of motion, okay? And I remember this study that was done at the University of Michigan, you know, it was done on a track, and they wanted to kind of find out what muscle is the muscle that you use that really gets you going and produces the speed. And they found out by doing the active EMG, it was the power of hip flexion. So if that muscle has a nice range of motion and strength, you will actually increase your power. You can actually increase your speed. And all you have to do to experience this is, if you're doing your normal run, okay, how high are you lifting your knees? And then lift them up a little higher, and all of a sudden you're going to find out that your speed is automatically increasing.
Right.
And then that goes along with then the gait cycle, you know, how quickly you're turning over, and it's all based in there too.
Right. There was a really interesting research study where they videotaped elite runners. I can't remember how many they took. It may have been the top 10 or something like that. And they did a video analysis to see what was different between the person who won and the subsequent ones.
Uh-huh.
And the biggest difference was this angle they call the stride angle. So it's here to there. This angle here is how high they could get their hip relative, the hip drive hip relative to the push-off leg.
Ah.
So if they had the person who won had the highest stride angle at the kick.
Yep.
Yep. At that last 100 meters. So, and that takes a ton of hip flexibility to be able to get there. Point taken.
Okay, well, we've covered the questions, but we haven't covered everything that needs to be shown. And Steve's going to go over that in another session in a few minutes. Okay?
Sounds good.
All right, I hope we answered your questions, and we can help you to have a pain-free and good season.
Absolutely. Stay well.
All right, we're going to go over a few anatomical terms. So when you start talking to either the athletic trainer or your physical therapist, you'll be able to more accurately describe to them what hurts. Now, some of these are going to be really simple, and some of them are really in the anatomical area. So let's have Coach sit down here. We're going to talk about the foot first. So if you're going to talk about the plantar fascia, that's this piece of tissue here at the bottom, okay? And when you talk about heel pain, this would be plantar fasciitis here, not on the side, okay? And if you have heel pain that's more back here, that's not plantar fasciitis. That's where your Achilles is attached to the heel. So if you are talking about heel pain, tell them where it is. Is it on the top and the back? Is it on the bottom? Is it on the sides? Because if you have pain in your heel that's like, and it hurts to squeeze here, that could be a stress fracture in the calcaneus or heel. So describing where something hurts is extremely important. And then when it comes to literally describing where things are, remember, this is the inside or medial side of your lower extremity. This is the outside or lateral side of the lower extremity. So if you have medial foot pain, it's going to be something over here. If you have lateral foot pain, it's going to be over here. And that's going to help in describing to the athletic trainer, to the physical therapist, maybe even the physician, where your problem is. And it's going to be easier to figure out. If you have pain here in the front, that means something versus pain up here. This is really what's called shin pain over here. If you have pain over here, that's a whole different thing. This could be something like even exertional compartment syndrome. Shin pain over here is your shin splints, maybe a stress fracture. If your pain is right here in the front, that's even more of a concern. So describing exactly where the pain is extremely important, extremely important. Now, if you go to the knee, what happens on the inside of the knee? Okay, on the inside of the knee for a runner, there's not really a lot of stuff you're going to be worried about unless it's right down here. Okay? People say, oh, my knee hurts, but really the pain is down here. Let me get the coach to pull down real hard against my hand. There's your hamstring tendon right there, and this is where it's attached. So pain here, even though people call this the knee, this is really hamstring tendonitis down here that it's taken care of pretty easily with a good rehab program. On the outside of your knee, this is your ITP position, right here at this little bump. And the ITP is a broad tendon right there, and down here it forks like this. And when this gets tight, it does this to the side of the knee, and it clicks over this little bump. This, again, is the lateral femoral condyle, and that's where the issue is. Okay? All right. Anything else? Okay. All right. Let me get you to turn on. And so, when you run, I'm going to have Coach make a little line here first. Okay. All right. Stand on your right foot. Okay. Now, this should be level. Now, I want you to drop this hip down. Don't bend your knee. I want you to just make sure that this drops. See, when this drops down like this, that's a weakness right here. Okay? So, when the foot hits the ground, that glute medius has to fire to keep you level. If it doesn't, this is what happens. And that's going to cause all sorts of problems over here. So that's important to look at. What's going on with the glutes, both the maximus and the medius. The maximus, this guy, is your extensor. Okay? That and the hamstring work to do this. Okay? The other gluteus muscles are your stabilizers, along with your piriformis. So it's real important to be able to look at those things and figure that out. And if, let's say that gluteus medius doesn't fire right, well, the next stabilizer for your hip is this very small muscle out here, which is the muscle of the ITB. And that's what can cause your ITB to fire, the tensor fasciae lata, to really irritate the ITB because that glute muscle just isn't working right. Okay? Hamstrings. All right, so hopefully your hamstring muscle, if you get an injury, it's going to be mid-substance in here. But if it's way up here and the gluteal fold, that's going to be a lot more difficult to take care of. All right, and when we get Coach to turn around, and so the hip flexors, there are two major hip flexors, and Steve even mentioned earlier how it's how that rectus femoris comes all the way up here. But I'm going to show you on a little model here. The deep hip flexor is the iliopsoas. Okay, so it's two muscles. This is the psoas portion. This is the iliacus portion, and some young people will talk about a pocket, click it right here. That can be that iliopsoas muscle clicking right here, that tendon. And that attaches right here to the inside of the femur, and that is a major hip flexor. That is a powerful, powerful muscle. But this muscle, as you can see, is also attached to your lower back. And so this can cause back problems if it's too tight. So it's real important that understanding when we talk about hip flexibility, it's not just your quad, it's also this deep muscle movement as well.
Then lastly, can you just talk about the SI joint? What is the SI joint? How does that affect the whole entire body?
Yeah, we don't have the other model here.
Or now where it is on me
Okay.
and also on
So the lowest functional part part of your spine is your sacrum, right down in here. If I can move this apart and show it to you. Okay? That's this bone down here. And it has a joint on both sides of your pelvis. So that's right here and right there. Now, in orthopedic surgeon thinks there is zero movement in this area, okay? But there can be a little bit of a tweak, twist, a movement pattern like this in that area and cause really bad problems. Now, the movement of the pelvis is going to be dependent upon the flexibility of the hamstrings and the flexibility of the hip flexor. So if this is off, this is going to turn or twist one side of the pelvis or both sides, causing this dysfunction, that's pain with function. And it's going to be real important to keep this in tune. And Steve will probably address some of those issues too. Okay?
Okay, so I'm going to demonstrate now some stretches and some strengthening exercises that were asked about in the questions. I want to review again what Dr. Cutter talked about with this hip flexor muscle, how it attaches into your low back. That's why it is such a tricky muscle to stretch, because it attaches to your femur, your pelvis, and your low back. And in order to get a stretch, you have to stabilize your low back muscles. So, in order to get a stretch, and you can do a lunge stretch like this, but because that muscle attaches to my back, you have to keep your back real still. So I can lunge into a stretch, let my back go, I feel nothing here. But watch when I flatten my back and I get my leg back, now I'm getting a pretty strong stretch. See, I don't know if you can see through my shirt, but it's flat here as opposed to there. So that is the key to stretching this. You can also kneel. Again, you've got to flatten your back, hold your abs real tight, and then you lunge forward, and then you can get a static stretch on that hip flexor. Not allowing this to happen, right? Keeping it tight. Now for a dynamic stretch, this is a great activity, free run. I don't know how much range you have here. I'll do a walking lunge and go across. So you can go down and rotate. So you can see how I'm getting into that hip extension, keeping my back flat. That's a great dynamic way to open up the hip and get that hip flexor moving. And remember we talked about that stride angle. So we're actually creating a stride angle here that will help you when you're running, especially when you're doing that end of the race kick. For other hip mobility activities, you can use these heavy bands. So like everything, you can buy this on Amazon. We also buy them from a company called Perform Better. Real thick, heavy bands. So for those of you who have the really tight hips and mobility issues, you can get in there real tight, and the band actually creates a stretch to the joint. We do this a lot right before doing heavy squats, weightlifting. And you can fall into it and let the band do some pulling. So we'll do a stretch like this, and then we'll turn 90 degrees, and we'll stretching my joint this way, and then the leg goes out that way. So using the band to assist in getting the capsule, it's a very tight joint, and to help open up the hips. And then dynamically, walking lunges I just demonstrated, and then the gate opening, and the gate closing, and leg swings. Those are kind of my favorite little series of hip mobility. You can do static stretching using the band, and then dynamic with the walking lunges, leg swings, and and then the gate opening and closing the gate. Okay, pause there. Okay, we'll talk now about some band strengthening. I'm sure a lot of you do this. And this we talked about in the other session about preventing iliotibial band syndrome. This is one of the key exercises that can help with that because it'll work these outer glute muscles. And it works in an endurance way. You want to get 15 to 20 steps in each way. This exercise is very easy to cheat on. Okay? So this is cheating. Rocking your shoulders, lifting your hip pelvis up like this. I'm not even working my glutes at all, I'm just working my back. And you'll see that a lot. So the proper way, these pelvis needs to stay level, and you just basically slide your hips out. If the band feels too heavy where you can't do this without cheating, just move the band up. Put it above your knees. It's still a good exercise, it just makes it a lot easier. So you can adjust by changing the band or moving it up or down, depending if you need it harder or easier. Okay? So nice and level. Another great exercise, again for these deep rotators, it's like a little mini squat, and then you just twist your legs out. Twist out. This is getting those deep hip rotators like the piriformis, and there's 6 of them in there that work together to control your hip. They're very important for preventing knee pain, IT band problems. I would even say plantar fasciitis. If you have strong hips, it helps all the way down the chain. Okay, so this is a great one. And on the last run, you can just kind of oscillate like this to a quick hold, a little oscillation, and it'll just burn like crazy. Pause it there.
2, 1.
Okay, there was a question about the best core exercises, I believe. It'll be easier for me to show you my least favorite first, and try to get the word out that this is not a good exercise for anybody to do because it's not good for your back. If you remember that psoas muscle, go off camera for a second, attaches into your spine, right, this hip flexor. A lot of people use this mistakenly to do what they think are abdominal exercises. And that's commonly seen doing these leg lifts, like that. So, this is an exercise that is very stressful on your spine, and you end up overusing that hip flexor muscle, so it ends up making that hip flexor muscle tight, which is not good for running. So I would just scrap that from the playbook. There's a lot of other ways to work your abs. It's okay to do bicycle because your legs are up and you're protecting your back. But once your legs get down here, it's very stressful on it and can actually lead to some back pain and sacroiliac joint issues, which are that pelt where your pelvis is, the hip flexor is attached to your pelvis. So some good exercises for the core. This is one of my favorite. Using a heavy band or any kind of exercise band, you just hold it real tight like this. You stretch it out like that, and it's just crushing my obliques here. You can do holds, you can do some turns, you can do some oscillations. 3 sets of 15 or so on each side, and then you can do some isometric holds holding for like 10 to 15 seconds. And what's great about that is you're working your obliques while you're standing. When you're running, you're standing, right? You're on your feet. So this is a functional way to work your obliques. Another great way with a dumbbell. Same thing, standing, working obliques. With a dumbbell weight, So it's more functional, more practical. It's also a way to get oblique work in. And then obviously switch sides. For coaches, this exercise is actually can be done with a partner. So you get your partner up, and one person's holding steady while the other person's actually pulling the other side. So instead of having an anchor, you have another person as the stabilizer. All right, so a couple other exercises that are good for core abs. The Bosu ball, standard crunches, and even more importantly, side crunches. And then of course, the plank. That's working the side muscles. And the obliques are the most important abs to work. So if you don't have time to do it all, at least work the side muscles, the obliques, which are side crunches and then these heavy bands and the dumbbell weight like that. All right, another big part of the core is your glute maximus. So anything, squats, we'll do these banded squats. Where's my hand at? Squats and lunges. You get the nice wide base, and working squats like that. That's getting glute maximus and the deep rotators. You can do it loaded with some dumbbells or a kettlebell. That's getting a great combination exercise. Because people forget that the glutes are a very important part of the core. And I'm a big fan of bridges as well. So these are actually pretty tough without any weight. Let's do one-legged bridge. Hands to the bench, or you just do it flat on the ground. And that's a great glute exercise. All right, last thing we'll talk, I think it might be the last thing, calf stretching. You got it. So this is a handy tool. Could be a good little woodworking project during this pandemic. If you're stuck at home. Anyway, I think a slant board is your best way to stretch your calf. And I talked about little details. Okay, very important. You can see my foot. As I roll to the outside, I'm lifting my arch just a little bit. So on the board, I'm lifting my arch. Hold it, and then go up and over the board. You do both feet, raising both arches up, and then you just hold it. The typical way to stretch is like this. I'm just going to get back in here. So this is cheating. I don't know if you can see how my foot's kind of flattening out. This is the way you do it. Raise the arch up. And then go forward. So the difference, arch up, and lunge forward. And then the last best way, any vertical surface is a great calf stretcher. So that's a safe way. It's hard to cheat when you do it this way. This might be the best way actually out of all of them. You don't even have to worry about your calf on that one. All right, you pause it. Good? Okay. All right, so I'm going to show just a couple little details. There's a question about decreasing heel striking. And I mentioned one of the easiest ways is to increase your turnover. Try to make a 5 to 10% increase in how fast you turn your legs over. And I didn't mention this before, but a great way to do that is to listen to music. And Spotify actually has a feature where you can choose a playlist based on the beats per minute. So let's say you want to try to increase your turnover to 180. You just find a bunch of songs that all have a beat of 180 beats a minute, and then you just run to the beat of the music. So that's one way you can increase your turnover. The big difference between overstriding, landing way out here, and more of a efficient strike One of the big differences is how you have a forward lean. Okay, so if you're overstriding, you'll be vertical, and you're landing like this. If you're midfoot striking, you're going to be more in a forward lean like that. So when you're doing your skips, get yourself in a little bit of a forward lean, head up, chest up, and then you can work the A skip. Always toe up in the front, and then you land right on your midfoot. So I see a lot of people doing this. Okay, that's not going to help. You want to get in that forward lean, almost fall into the skip, land on that forefoot. Okay, forward lean, I'm kind of falling, moving my legs to keep up. And the butt kicker, that one naturally puts you in a forward lean, so that's a great drill. You just got to make sure you don't keep your knees back. You want to bring the knees forward. It looks like that. Knees coming forward just a bit. And that puts you already in your forward lean and midfoot strike. And then this is the drill I'll do a lot of times. We'll start in a butt kicker, then convert it into a run. Because the butt kicker puts you in the forward lean, puts you on the forefoot, and I'll just do it to the end of the hurdle and then turn it into a run. So it looks like this. Butt kicker, then just run. You keep the same cadence, forward lean and foot strike. That's one drill. Another drill which helps prevent overstriding, they just call it the stumble reflex. You'll see this a lot online, where you just have a runner, you just fall, 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 and then run a few steps. So it helps you develop that sense of falling into the run. So it's fall, 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 and then just start running. So that'll keep you from being too vertical in your run stride. Is there anything else?
Hi, Blue Ridge Running Camp. We're here at Lucky Road, which is a running store found throughout Central Virginia. And we're going to hear from Jeff Van Horn, the owner of Lucky Road. He has sponsored camp for many, many years. We are going to listen to Jeff as he talks about running shoes, gait analysis, and other pertinent information to help you become a more informed runner. So, let's hear from Jeff Van Horn, the owner of Lucky Road.
Hello, Blue Ridge. This is Jeff Van Horn with Lucky Road Run Shop. I'd like to take a few minutes today and just discuss a little bit about how to tell the difference between a neutral and stability shoe. And it's one of the questions that I do get asked frequently about what's the difference between a neutral and stability shoe. Well, to start with, we want to go a little bit over gait and how the foot functions. Now, when we run, typically there are three phases to what we call our gait cycle: heel strike, mid stance, and toe off. Just before heel strike, the foot should invert about 4 degrees and hit the outside edge of the heel, which is why you see wear on this outside corner of your shoe. It's perfectly normal. But once the foot strikes the ground, it's necessary that it roll inwards. This inward motion is what's about as simple as I can explain it, is what we call pronation. And pronation is a good thing. It's the foot's natural mechanism of shock disbursement. Without pronation, the foot hits the ground, shock goes up the leg, and that's not good. We want the foot to hit and roll. But we want pronation to occur to a neutral position where the heel straight up and down, the arch is stable, and the foot propels off the ground evenly. That's a neutral gait. That's what we want to see happen, and that's what we would recommend what we classify as a neutral shoe. Now, in my opinion, it doesn't really matter who makes it, doesn't matter what it looks like. What matters is individuals with a neutral gait are better served in the neutral category. Now, the category known as stability is designed because about 35% of people who run still hit the outside edge of the shoe. They pronate to a neutral position, but they roll a little too far where they over-pronate the shoe. In which case, stability models have a device right up underneath the midfoot that's designed to kind of block that excess motion and get an over-pronated gait to toe off evenly. So stability class is there to prevent that excess motion. In a nutshell, that's the difference between a neutral and stability shoe. But as always, it's important that you try things on, test it out, and go with what feels most comfortable to you. this particular segment, I want to talk a little bit about how a shoe should fit. So when you're at the store trying on shoes, regardless of where you go, a couple of things you need to be aware of is how a shoe should fit. Now, the first thing we want to know, or the first thing we want to do is get the heel to situate just right. You want the shoe to act as a part of you, as an extension of your body. You don't want it to be some box that your foot slides into and you're sliding around it. That creates an unstable platform, increases the risk for injury. So in terms of getting a snug fit in the heel, the first thing you want to do is get in the habit of tapping your heel back in the shoe. That'll force your foot to the back so that when you do tie the laces, this is nice and secure. The second thing you want to look at is the length of the shoe. Now, it's important to have a little bit of room between the longest toe and the end of the shoe because the foot does expand and contract with every footstep. But keep in mind that as a scholastic athlete, you're running a significantly faster pace than somebody who's, say, like me, middle-aged marathoner. So I might need a little bit more room in my shoe than, say, a high school track athlete. So what you're looking for is just a little bit of room to be comfortable so that the foot's not banging the end of the shoe. You don't want your toe touching the end, but you want room so that the foot can expand and contract properly. You also want to have the widest part of your foot, which is the big toe joint. That's the widest part of your foot. You want that to be matched up in the widest part of the shoe. That's also where your foot flexes, and you want that matched up to where the shoe flexes. You can also take a look at the lacing system. If the lacing system is drawn in too tight, it means the shoe's probably too wide for you. But if the lacing system is V'd out at the top, or you're having just a little bit of trouble getting enough lace to tie the shoe, that means the shoe's probably not wide enough. So a couple little tips on how the shoe should fit. Hopefully that helps in your search for the proper running shoe. In this segment, we want to talk a little bit about how do you know when a shoe needs to be replaced. So a couple of things to consider. A lot of people keep track of the amount of miles. Your typical running shoe is going to last about 300 to 500 miles on average, 400-ish. Some people get a little bit more, some people a little bit less. Quite honestly, person's body composition, their weight plays a role in it. Obviously, somebody who's 200 pounds is going to compress the midsole of a shoe a little bit quicker than somebody who's like 100. All right. A number of other factors play into how a shoe is going to last, how it's stored. So for example, if you were to leave your shoes out on the porch and where they're exposed to the elements, like the wind, the sun, the rain, all that good, or the heat and the cold, or inside where the climate is controlled, it's going to affect how well the shoe lasts. Not a good idea to leave them in a hot car in the summer either. It's a good idea to keep them inside. But a couple of things to consider. One is that a lot of times people will take a look at the wear patterns on the outsole. You're going to see significant wear on the heel because that's where you get your high abrasion area and across the ball of the foot. Now when this starts to get to a point where it wears thin, that's an indication that you might have a few miles on it and it could be replaced. You also want to take a look at what happens with the upper. If you get to a point where the upper is no longer holding the foot stable on the platform and it's kind of loosey with inside and you're not getting that snug fit in the heel anymore, it's an indication that maybe the upper's stretching out to a point that it's just not going to hold your foot well and it's not going to operate as effectively as it could. If you start to get holes in the upper, that's also not a very good sign. But the lacing system, if it gets drawn in really tight, you're really pulling on the laces to get that snug fit, it's an indication that maybe the shoe's starting to wear out. But the single most important factor to consider, regardless of miles, regardless of how long you've had the shoe or what the shoe looks like, it's how it feels. So use your imagination here for a second. Think about the time you got a brand new pair of shoes and that first run you went on it, and the shoe just fit you really well, and it just felt like this amazing run as you were running across the road or the trail or wherever it was you were running. Now fast forward a few months, 300-400 miles or so, and you're going out, maybe the shoe's feeling a little bit stale, it's not giving you quite the cushion or support that you felt that it had, or maybe you're feeling a little bit loose in the shoe. Your perception of how the shoe fits is the single most important factor to consider. When it gets to a point when it's no longer comfortable, that's the biggest indicator that the shoe needs to be replaced. So anyway, I hope that helps you in determining how long shoes should last and when's a good idea to get a new pair. In this particular segment, we're going to to address a topic called heel-to-toe ratios, or the ramp of a shoe. It's a question that we get quite frequently, and quite honestly, I do believe that there's a relationship that's important for us to consider when we're talking about the distance from here to here and how much the shoe drops. Your traditional running shoes typically have a 2-to-1 ratio, or like a 24 to 12 millimeter drop. The reason that they would have like a 12 millimeter drop is back in the day when they were originally doing the studies on running gait and running shoes, back in the 60s and 70s and even the 80s, we were aware that the majority of people who run land on their heel. And that is just normal. And even recent studies show that about 94 to 95% of people who run naturally land on their heel. Nothing wrong with that. That's just the way it is. Now, the reason for a 2-to-1 heel-to-toe ratio was that the materials being used back then were considered what's called sheet EVA. So it was a very, very porous and spongy material. And that when the foot did hit the ground, we were getting about 50% compression set in the midsole. So, as irony would have it, once the foot struck the ground, you were compressing the midsole about 50%, and as you rolled into mid-stance, you were at 0 drop before the foot propelled off the ground. Now, as we've advanced in the years, the materials have gotten a little bit better, a little bit more durable. We can have a really good cushion shoe without jeopardizing, without giving up too much in the impact forces. So, many cases now we're seeing shoes at 10, 8, so anywhere from 8 to like 12 millimeters considered average these days. But when we get below that, like 6 and 4, and in some cases even 3 or 0, the difference that it has on the natural gait is that the lower the drop, the lower the heel-to-toe ratio, the more likely the foot is going to land mid-stance. Now, this is neither good nor bad, it just is. And I know that some of us, as we run a little bit faster, we're going to land a little bit more midfoot to forefoot. Typically, the slower that we run, the more we're going to land on our heel, and that's fine because you're going to have your easy days and you're going to have your hard days. In which case, you might want a shoe with a higher heel-to-toe ratio when you're running distances, or a shoe with a lower heel-to-toe ratio when you're doing your track workout. But there is no one best heel-to-toe ratio that's out there. The thing that I'm going to leave you with again is the single most important factor to consider is how does the shoe feel to you? How does it feel when you run in it? Because if it's not comfortable in the store, my advice is don't get it. And certainly don't let the shoe salesman like me talk you into buying something if you don't like it. You got to test the shoes out and determine for yourself what's comfortable. But again, keep in mind the heel-to-toe ratio. It's one of those variables to consider. But don't make your decision based solely on what the drop is. Make your decision based solely on how it feels when you run with it, okay?
Good evening, Blue Ridge Running Camp. This next speaker that we have coming up is Sara Hamidovic. She is a 2004 West Point grad. She served in the Army from 2004 to, I believe it was 2009, if I remember correctly.
Yep.
And during that time, Sara served gratefully for us in Iraq, and she's currently an engineer. And she's going to do a presentation and talk to you a little bit about leadership, because leadership is something that we really need to look at as we take part in team dynamics. And so being a leader is a critical component of being a part of any team, whether you're the leader or you're leading a drill. So with that being said, Sara, I'm going to turn the floor over to you, and thank you for coming to share your insight with us here at Blue Ridge Running Camp.
Glad to. Let me share my screen here. All right. So as he said, my name is Sara Hamidovic. I am, as he mentioned, a veteran of the U.S. Army, graduate of West Point, and people ask me to come and speak from time to time. So I've put together this presentation basically discussing some of the ways that I think that leadership has played a role in my life and the things that I've learned. I try and do it in kind of a fun way, using some stories and things that have happened to me along the way. So it's my crazy ride. So the first lesson I've learned is if you want something, just suck it up and go get it. And so I think I learned this early in my life, watching my parents do what they do. My parents were some of the hardest working folks I've ever known, still are. And I've actually got a picture here. This is my mom and I. We bought an old building. It was a school that was built in 1930. And this is where my company is called Vet Environmental Engineering. We're an environmental consulting company. And Coach Helmer's son works with me at this company. And so my parents and I bought this building that was a pretty rundown old school from the 1930s. And I've basically watched my parents renovate old buildings like this my whole life. And what I've learned in so doing is that, no matter how hard something looks, no matter how insurmountable things may seem, if you really want it, you can make it happen. There's the old adage about how do you move a mountain, and you do it one rock at a time. So that's basically what we've done with this building. And nothing is too big. You put your mind to it and you go get it. So that's the first lesson that I've learned. Lesson number 2, teach them, believe in them, and give them a shot. So this one, I am the proud mother of a 12-year-old son. His name is Otis. He's kind of a staple on our track team. I coach for Coach Helmer's son, Justin. I'm the throws coach at Bloomington North here in Indiana. And so this is my son, Otis. And one of the things I've learned through basically everything I've done in my life is that people can surprise you. And this little guy here is one of those people that surprised me. And as you can tell there, he's probably, 5 or 6 years old, and he's operating power tools and building something. That thing there on the left is something I built, and he wanted to build something as well. And so, in the Army, on sports teams, in my company now, I just learned that if somebody wants a shot at something, teach them, support them, and give them a chance. And what I've learned about that is that a lot of times people will surprise you. And the other thing that has kind of been true throughout my career and my experience in my life is when you teach someone something and when you support someone in doing something, it makes you better as well. And so when I was in high school, I was pretty good at throwing. And I remember a lot of times the practices at the high school weren't necessarily that informative to me because I had done a lot of on the side work. I'd worked with some private coaches. I did weight training outside of school. And so I kind of took it on myself to help some of the other kids do better. And I noticed right away that when I started teaching them and helping them, it made me significantly better as an athlete as well. And that's just a great leadership lesson. Don't doubt people. Give people a shot. Teach them. Give them a hand. And like I said, one of these days they may surprise you. Lesson 3: you're only as strong as you think you are. And this is a fun one for me. That's me in, I think about 1996. I was a freshman at Bloomington North. And this picture was printed in the yearbook, and I didn't really see it until years later, or it didn't stand out to me until years later. But I remember when I was a freshman throwing disc and shot at Bloomington North, I thought that I was the toughest thing around. I thought that I was so good and so strong, and I thought that all of my competitors must think that I was so scary, so intimidating. And then years later, I saw this picture, and it's hilarious to me because I look like a little baby. I don't look at all scary. But the thing of it is I thought that I was. And so I was a fierce competitor, and I was good at what I did. So it doesn't necessarily matter how you look or, how you're built or any of that stuff. What matters is what you think of yourself and what you think you're capable of. So me in this picture, I thought I was capable of anything. I thought I could, I would win all the meets, I would do all the things. And it's just ironic kind of to see what I actually looked like. But yeah, you're just as strong as you think you are. So believe in yourself and give yourself a shot too. And tell yourself that you can. Positive self-talk, and do your visualization and picture yourself winning and, you know, succeeding. So yes, you're just as strong as you think you are. So prioritize and persevere. So this one is a lesson that I learned when I was at West Point. So I don't know how much you guys know about West Point, but it's a 4-year military academy that when you're done, you graduate as a second lieutenant and you go on to serve in the Army. And so this was my platoon during my second summer at West Point. And I think if I push that red circle there, that's me. You can tell I look pretty bloody miserable. West Point was tough. It's a lot of credit hours. I was doing 2 sports. I played both volleyball and track for West Point, and so having a Division I sport every semester, we had volleyball in the fall, and then indoor track in the winter, and then outdoor track obviously in the spring. And so it was tough. It was a lot of work, not a lot of sleep always. And so one time I was really struggling in one of my math classes, and I was struggling because I wasn't able to devote the amount of time I felt like I needed to in order to learn the material that I needed to learn to succeed in this class. And so I went to office hours with my professor, and I remember that he explained to me how to manage my time. And it's something that I've brought with me through my entire life, and something that I've told my coworkers now. But what he told me is, imagine you're sitting at a desk, and obviously this is going to be Army terms here, but imagine you're sitting at a desk and the desk is completely covered in little bombs, like the ones you see in the cartoons that are little round bombs with the little fuse on them. And so what you've got to do is you sit down at that desk and you look at the bombs on that desk and you figure out which one has the shortest fuse. And you grab that bomb and you put the fuse out. And then you move on to the next one. And then you move on to the next one. And you keep going for that thing that has the shortest fuse, the shortest suspense, the quickest deadline. Or it could be the thing that's most important. If the fuses are the same length, then maybe you need to prioritize the one that is the most important to you, or the one that scores you the most points, or whatever the case may be, whatever it is that you're doing in your life. That's how I learned how to prioritize and to persevere through what seemed to me at the time like such a huge challenge, and something that I didn't know how to do. I was always very good in school, but West Point was just a completely different animal. And so when he told me that, it helped me kind of clear my mind, gave me a lens to look at my workload through, that allowed me to kind of see it more clearly and focus better. And so just prioritizing, picking that shortest fuse, and then persevering, never giving up, keep going, just keep pushing through. So lesson number 5 is fake it till you make it. And I honestly don't necessarily love the way that sounds, but for me, it's been true. It's been something that I've had to do in my career. And so this one goes back to when I graduated West Point and I was commissioned a second lieutenant in the Army, and I was sent to Germany. And when I went to Germany, this gentleman here became my platoon sergeant. And as you can tell, he's a very intimidating looking guy. He was actually a literal poster child for the United States Army. He was on Army commercials. And it just happened that the unit that I was sent to, up until the time I was there had never been a female platoon leader that took a platoon in that unit, at least not to my knowledge. And so when I got there, they told me that I wasn't going to get a platoon. They told me that I was going to have to work a staff job for 3 years, which was really, really difficult for me to cope with, because basically the whole point of going to West Point is to earn the shot at getting a platoon and leading troops in combat. And that's what I wanted to do. And so when I got to my unit, they told me I wasn't going to get a platoon. I was just going to have to work a desk job, which made me very angry. And so going back to that first slide, if you want something, go get it. So I got my platoon, and this gentleman showed up shortly after I got my platoon, and it was extremely intimidating to me because he was such an amazing soldier, and I was 23 years old, and I was a female in an all-male unit, and I remember the first day that he came to work, he kind of looked at me and he said, "I got the girl platoon leader," and it kind of hit me in my gut pretty hard, but I kept trying, and I just faked it. I faked like I wasn't scared. I faked like I wasn't intimidated. I faked like I knew exactly what I was doing. I did some things that probably made him think that I didn't know what I was doing from time to time. But ultimately, he and I became extremely close. We had an amazing working relationship. We ended up earning a combat mission in Iraq. And so we led the platoon together in Iraq in 2005, 2006. And so sometimes when you feel uncertain and you feel like you don't know what you're doing, my dad has always told me, just put your shoulders back, stand up straight, walk quickly, act like you know exactly what you're doing. And that goes for if you're in a situation where you don't feel comfortable, if you're by yourself on a dark street, act like you know what you're doing, act like you know where you're going, be confident in yourself. And yes, sometimes you have to fake it because sometimes you're scared and sometimes you're uncertain and sometimes you're lacking confidence. But if you fake it, eventually you will make it. So this is another one that I learned in the Army. Being a woman is not a disadvantage. And this goes for everyone, every gender, every person brings something unique to the table. And like I said, I was in Germany in my unit. When I got there, I was one of two female officers in about a 450 soldier battalion. And so I stood out like a sore thumb. There weren't very many of us at all. And the thing though that, this is actually a picture of the battalion. So those are all of our troops and some of our equipment in Germany. I was actually taking the photo, so I'm not in this photo, but one of the things that I noticed through time, I've had soldiers reach out to me even recently, years later, and say, "Wow, ma'am, you were just a really great leader." And I never felt like I was a great leader, but I was like, why? What did I do that was special? Or what did I do that made you feel like I was a good leader? And they said that we always knew that you care. And I did. I mean, I cared deeply about my soldiers. I definitely would have laid down my life for them. And I think that part of that, they said that I never had another officer that made me feel like they cared so much. And so the part about, being a woman is not a disadvantage, I think I was able to take that kind of maternal instinct that women have and play it in a way that was something that was comforting for my soldiers in a really tough time. We had a very rough year in Iraq, and it made them feel safe and it made them feel cared for. And I could also, rough and tough with the boys, but at the same time, each and every one of us has our own unique strengths. And I think that finding what that strength is and playing it up. So what are your strengths and what makes you special? Play those things up because, each and every one of us brings something unique to the table. And so if you're ever in a position where you're the only guy or you're the only girl, don't look at that as a disadvantage. Use that as an advantage. Understand that, hey, I'm different, and so therefore I bring something cool and unique and special to the table. Lead from the front. So this is one that has actually, unfortunately, become somewhat cliche. I don't view it that way, but it is. It's been, used and abused the way that people say it, but this is one of my trucks from Iraq that actually was hit by an IED. And this was not my truck. This was a couple of my soldiers. I was actually 4 of my soldiers were in this truck when it got hit. Fortunately, all of them lived through it. All of them are still around today. Granted, they have some bumps and bruises for sure. But basically what happened was we were driving through the desert and my lead vehicle hit an IED. And I was given specific guidance from my company commander that I was not allowed to be the lead vehicle, which was absolutely something that frustrated me because I had a very difficult time with asking my soldiers to drive somewhere where no one else had driven, because I felt like that was not leading from the front. And so when these guys got hit, like I said, we were in the middle of the desert. We weren't necessarily even on a road. And I didn't have any commo, so I couldn't talk on the radio. I couldn't get a medevac to come and get my guys out. And so we ended up having to ground evac them to the next closest outpost. And so what ended up happening, everyone was a little bit shook up because it was a big, it was a big explosion that went off, and we were all very freaked. And so I didn't know where to go. I didn't know what to do. I saw lights up ahead and we were going to head that way. And so, whenever everyone is scared and a little bit freaked out, and we had soldiers that were injured and needed to get to a helicopter so they could get out of the country and get medical care. And so what I told my guys to do is get behind me, put your tires where my tires are, do not drive outside of my tire tracks, put the pedal to the metal, and let's go. And so at times like that, that's what leaders do. Leaders, they just get out in the front and they lead from the front, and they, leaders find the strength that gives the other people strength, that gives the other people faith. And yes, I was scared out of my mind. I was extremely angry. I was very, very, very worried about my soldiers. I wasn't sure if they were going to be okay. And so I just had to, put all of my emotions aside and just say, okay, well, this is the job that needs to be done. I've got to get these men to the helicopter so we can get them home to their families. And so everybody get behind me, put your tires where my tires are, and let's go. And we got them out that night. And like I said, they were all fine. Fine eventually. They definitely were wounded and injured and things, but looking back, I don't exactly know what gave me the strength to do that, but I think it was for them. I think that I knew that that it was my job to take care of them. Like I said on the last slide, I cared deeply about them. And so sometimes that's what you got to do. The leader has to do the difficult thing. The leader has to show the rest of the folks that they're willing to do the difficult thing. Otherwise, those folks don't want to follow that leader. And so leading from the front is a big deal. The leader should never get the first bite of food. The leader should make sure that they're there when the workout starts and they're there when the workout is done. Leaders lead from the front. So this is an example of that. So when the going gets tough, put on a brave face. So this one, I'm now out of the Army, moved on into my life. I came back to Bloomington, Indiana after I got out of the Army. And I actually started working for my dad. There's the school I talked about earlier. That's our building. It actually now has all new windows in it and looks much, much better than it does in that picture. But like I said, I started this consulting company. So I worked for my dad for a while, and then I stopped working for him, started my own company, and then eventually bought my father's company as well and combined the two companies together. And it has been an absolutely wild ride running a company. Had some serious issues from time to time with personnel. There have been times where I am so overwhelmed and tired and just worn out. And there are times when I don't know the right way to lead the company. There are times where I've made mistakes and, steered the ship in the wrong direction. And on all of those occasions, I wake up in the morning and I don't necessarily want to get up and go to work. I don't want to go in and put on a brave face, but that's what leaders do. And so without fail, every day I get up, I put on my brave face, I go to work, and I work through the issues. And it is hard and it's challenging and it's exhausting, but that's what leaders do. And so when the tough gets going, you just got to get up, you got to put your pants on, you got to put one foot in front of the other, go to work. And one thing that I have found is that you always work through the issues. At times it seems insurmountable, at times it seems impossible, but eventually you will work through it. You will come out the other end. And the thing that I've learned about that is when you are at the other end, when you've worked through that issue, first and foremost, you hopefully won't see that same issue again, because now you're smarter and you have the tools that you need to identify issues before they happen. But on the other hand, you also have this sense of pride and sense of accomplishment because you worked so hard through something that you weren't sure you could do. And now you're standing on the other side looking back, and it gives you a distinct sense of pride in the fact that you got through that very difficult thing. So when the going gets tough, put on a brave face, put one foot in front of the other, keep on breathing, and just go and work through it. This is another one that is absolutely a cliche. This is something that they taught us about at West Point. So basically the way the Army works is that there are all these platoons, and they have, soldiers that generally range in age between 18 and 35 years old. And then they get this new boss that's this new platoon leader fresh out of either West Point or ROTC or OCS. And those platoon leaders are typically 22, 23 years old. And then you've got the platoon sergeant that's probably 35, 40 years old. And so you've got this 22, 23-year-old young buck coming into this platoon, and they're in charge. And so it oftentimes creates a power struggle between the new lieutenant and the platoon sergeant. And so one of the things they always warned us about was when you get to your platoon, if they say that's the way we've always done it, challenge it. Ask them why. Why do you do it that way? Because people fall back on this, well, that's how we've always done it. Well, just because that's how you've always done it does not make it right. That does not make it the right way. It does not make it the best way. It doesn't make it the most efficient way. And so when someone tells you that's the way we've always done it, always say why. And a lot of times that people will be taken aback by that because, well, that's just the way we've always done it. And so this was something that I learned in my dad's company. And this was something similar situation. My dad's been doing this for 30 years. And here I am, I come into his company, and I ask him a question. Why do we keep all this paper? Why do we have all these lab reports that are paper? Why don't we have those scanned in? Well, that's the way we've always done it. I like paper. That's the way we've always done it. And so it was a source of contention between he and I. And when I eventually bought the company, we got rid of all that paper. And so I think that as a leader, you've got to understand that it's your responsibility to figure out the best way, or the best way as you see it. And so my dad still years later gives me some, a little bit of heck about getting rid of his paper. But we were filling 2 of those giant bins up a day. We were getting rid of so much paper. But now in our company, we're nearly paperless, and it's more efficient. It's easier to find things. We have much, much more room to store equipment because we don't have all these boxes of paper laying around. And so this is just one example of when you step into a new role as a leader, or if you're a member of a team, and you see something that doesn't quite make sense to you, or you don't understand why it's done that way, ask that question. Why do we do this way? And if someone says, because that's the way we've always done it, challenge that and say, can you explain to me why? Because I could see that, this way, or doing it, this thing might be more efficient or might make more sense. And a lot of times people just kind of get in a rut, and they do things the same way over and over and over again, regardless of whether or not it makes any sense to do so. And so sometimes having that new blood come in and ask those difficult questions kind of spices it up a little bit, shakes it up, and, get some new ideas and some fresh feels and things in there. So always ask. If someone says that's the way we've always done it, just say, can I ask you why? Have a sense of humor. This kind of goes back to just through all the challenges. This is my last lesson. Through everything that I've gone through in my life, whether it be being deployed to Iraq, or going through West Point, or being a college athlete, being an owner of a company, being a parent, being a high school student, being any of the things I've been, I believe the thing that has been the biggest deal for me is having a sense of humor. And the second part here, it's business, not personal. That is something that I struggle with to this day, very, very, very mightily. I'm one of those people, I'm very passionate about everything that I do. I try to give everything I do my all the time. And I take what I do extremely personally, which is why some of the things I mentioned in my business have been so difficult for me to cope with, just because it is so personal for me. It's, up there with my son as far as things that I'm proud of and things that I've built. And so being able to understand that, team dynamics or things that go on at school or things that go on at work, while you can be very passionate about what you do and take it very, very, very seriously, it's not necessarily personal. And so when you have conflict in those situations, or if you don't necessarily agree with the way someone else is doing it, or you struggle to get along with someone on your team or at your school or at work, try and remember that it's business, not personal. Which, again, trust me, it's very, very, very hard. I struggle with it to this day, and I probably will for the rest of my life. And actually, the picture that I have here about this, that's my company logo. And so when I'm carving a jack-o'-lantern with my son or making a gingerbread house with my son, I'm carving my company logo, or I'm making my company logo in icing. And so I take it very, very, very personally. And I'm very, very proud of my company. But at the same time, I have gotten a little bit better about trying to lay it down at the end of the day. Trying to put work out of my mind and have some peace and some solace at the end of the day. And so I think that if I was able to take my own advice here and be better at knowing that it's business, not personal, my life would be a better place. And so if you can kind of internalize that and take my advice now, I think it will behoove you and benefit you in the long run. And so lastly here, this is a quote from Eleanor Roosevelt that kind of speaks to some of the things that I said during my presentation. And what that is, you can read the quote for yourself. But basically, the thing that, people always ask me, what was the best thing that you got out of West Point and out of your service in the military? And I always, without fail, and I've thought about this time and time and time again, what is the best thing that I got out of that? And the best thing that I got was knowing what I'm made of. And what I mean by that is I've been in situations where things are exploding, and I've been in situations where people are shooting, and I've been in situations where, like I said, I had to jump out in front of a convoy and lead the way through what could be a minefield. And in all those situations, I was able to do that. And I think that at some level, I can draw a parallel with track and field here, especially running, because I'm not a runner, I'm a thrower. I throw heavy stuff. I don't run long distances or anything like that. But I think that when you've done something like that, when you've run a race and you have left everything you have on the field or on the track, you can look back at that experience and it gives you confidence and it gives you faith in yourself, because you say, wow, I can do that. I did that. So I know I can do that because I did it. And so being able to live through things and work through things, it will make you so much better throughout your whole life. And I stand by this steadfastly. Justin and I love hiring athletes. We absolutely adore having athletes work for us. And here we are, professional adults, we're nearing 40, and we are looking for people that were high school or college athletes to work in our environmental consulting company. And the reason for that is because athletes have had to push themselves through things that are difficult. Athletes have had to balance their time Athletes have had to take care of their bodies. Athletes have been in pain, have pushed through a tough race, or have, gone through a tough meet, whatever the case may be, have had to spent, gotten up early and gone to the weight room or gone to the swimming pool or whatever the case may be. Athletes do things that are hard, and it's no different than what I did in the military. When you are able to push through things that are very, very difficult for you, it makes you so much stronger, and it reminds you that you can do it. And so think about that. And after you accomplish something amazing on the track, give yourself a little pat on the back and be like, yeah, I just did that. And then go and beat it and do it again. So that's about all that I got. I'm gonna stop my share here.
Well, Sarah, definitely I want to say thank you for sharing those life lessons of leadership and your service to our country. We really appreciate that. One of the closing question that I have for you is, how do you talk about adaptivity, with being able to adapt in different situations? I know probably you had to deal with that in the Army and running your company, because right now we're in a time where we've got to be able to adapt with what's going on with the current situation with the coronavirus and everything. What should a leader do in that regard, being able to adapt and move forward?
I think as a leader, the thing that you always have to do is just think about your people. And so, the example that I have about the COVID stuff is when this all went down, I had employees coming to me with their concerns. I'm scared to be around people. I'm scared to do this, or I'm scared to do that. You always have to think of the good of the whole. But if you can do something, if you can make a move that satisfies or benefits 75% of your people, that's a win. So, the leader's got to be the one that can step back, look at things clearly, and make a call that is the best thing for the team as a whole. And so if you can get a majority or benefit the majority of the team, I think that's the best thing that the leader can do.
Like I said, thank you for sharing your leadership lessons and your service. And I know here at Blue Ridge Running Camp, we are thankful and appreciative for you and everything that you've done. So,
thank you.
Campers, we will we'll conclude a little bit with this session in a little bit. But thank you, Sarah, for your presentation. It was very, very well done.
Good. Thanks for having me.